My name is Dr. Joe Childs, and I'm a board-certified chiropractic neurologist. And if you're watching this video right now, you probably have already started as a patient in our office, and you were unable to attend our Fundamentals of Health or our new patient orientation done live in the office on Thursday night. So for whatever reason that you're not able to attend the workshop live, we're going to do this workshop on DVD so you can watch it in the comfort of your own home. So again, this workshop is called the Fundamentals of Health, and in this workshop we're going to talk to you a little bit more about your care in our office. We're going to talk to you a little bit about the chiropractic health philosophy so you can get the most results from your care. So let's get started. What makes us different? Well, we do three types of care in the office. We do metabolic care, neurologic brain-based care, and biomechanical care. Metabolic care is the nutritional care that you're going to get in the office. It's the food sensitivity testing. It's the blood work that we do in the office. And we base all of our nutritional recommendations on your blood panels, your sensitivity panels, your stool microbial ecology panels. So if you are a patient that we recommended metabolic care for, make sure that you get your panels done right away, that you don't delay in getting them done. They usually take about 3.5 to 4 weeks to get back. So one of the big pitfalls with patients with metabolic care is they tend to forget to get these things done on time. It's very important. The second type of care is neurological, brain-based care, and that type of care, what we're doing is we've looked at certain parts of your brain that may be weak, certain parts of your brain that need to be improved upon, that may be causing some of your health problems, and the whole goal there is to improve brain function. And then the third type of care is biomechanical care. Biomechanical care, we look at the structure of the spine and we determine if you have normal or optimal biomechanics in your spine, and the goal is to correct and improve the structure. We're going to talk very heavily about biomechanical care today. Almost every patient that comes into our office with chronic health problems needs biomechanical care. In fact, most people with chronic problems need all three, but sometimes the patients only come in and all they need is biomechanical care. Okay, so we're going to talk about these types of health care today, but we're going to talk more about biomechanical care. There's really two types of patients that come into our office. We have a chronic patient and we have a wellness patient. A chronic patient is somebody that comes in that has a chronic problem, whether it's a herniated disc in their back, chronic back pain, neuropathy in their feet, diabetes, thyroid conditions, fibromyalgia, dizziness, vertigo, you name it, all these chronic types of conditions. And the goal of care is to reduce the pain that you have that you've come in with, reduce your symptoms. We want to improve your blood work, improve your metabolic function. We want you to regain your health. Okay, if you come in as a chronic patient, our goal of care is to get you to get healthy again. And then we also want to correct the structure in the spine. And you'll understand more about that as we go along. The other type of patient is a wellness patient. A wellness patient is a kind of patient that starts care and they really don't have any symptoms, but they sort of get the big idea that it's better to prevent and to be proactive rather than reactive. Our goal with chronic patients is to get them as healthy as we can get them, to regain their health, and then eventually turn them into a wellness patient so now they're maintaining their health and being proactive. So you have two types of wellness patients. You have the one that comes in and gets the big idea of maintaining health before they get sick, and then you have the type of patient that was a chronic patient and now is a wellness patient. Okay? So that's the types of patients. So the problem with our health care system in this country is we are reactive instead of proactive, and that has a lot of effects, negative effects on our health care. These are U.S. health statistics. 1 in 2 die from heart disease. 1 in 2 will develop some form of cancer. 1 in 3 will develop diabetes. 1 in 3 women are clinically depressed. 1 in 6 couples are infertile. I mean, infertility is way on the rise, and a lot of that has to do with dysglycemia and PCOS, which is polycystic ovarian syndrome. That's a whole other workshop. 1 in 6 kids have neurological conditions. That's why we see kids with ADD and ADHD in our office. 1 in 8 people have an autoimmune problem. Whether it's a diagnosed one like lupus or rheumatoid arthritis or Sjogren's, or is it just an autoimmune disorder in their body causing issues. Gluten sensitivity is an autoimmune problem. 1 in 8 women are going to have thyroid problems, and we see a lot of thyroid conditions in our office. These are chronic diseases, and in our country we've really never have been sicker. World Health Organization, they studied over 100 healthcare systems in all the major industrialized countries in the world. The USA, they found out that we ranked #1 in crisis care. So you get in a car accident, you have a major heart attack. I mean, we're #1 in crisis care. We have the best medical emergency care in the world. However, there's some bad news. In 1997, the World Health Organization, when they did the study, we were 34th in healthcare, looking at overall health. In 2000, we were 37th. In 2007, we were 48th. In 2009, we were 50th. Do you see a trend? We're going down. The USA ranked 41 in life expectancy, so we don't live the longest out of these other countries. Here's the thing, we spend more on healthcare than any other system. Any other system out there, we spend the most, but we're ranked number 50. We're not number 1. So obviously something is wrong. If we just follow the typical medical system that we have, it's not really working. So the question is what is health? Well, the truth is in the numbers. Here's the thing. In this country, we have the highest rates of heart disease, the highest rates of cancer, the highest rates of stroke, diabetes, chronic pain, out of any other country. We've got the highest rate of these degenerative illnesses. That's pretty scary when you think about it, because we spend the most on medicine. If you look at the number 1 killer is heart disease, number 2 is cancer. The 3rd biggest cause of death in this country, most people don't get this, but it's adverse reactions to prescription medications. It's the 3rd biggest reason why people end up dying in this country is prescription meds. 90% of the U.S. suffers some type of spine-related pain in their lifetime. Okay? So you're not alone. If you're sitting there watching this and you've got chronic back pain, 90% of the people are going to end up with it. And our healthy life expectancy is only 48, which means we only live to 48 without disease and all this decay, all these degenerative illnesses, meaning that should be higher. That should be at least 65, 70. Okay? But what we're doing is not working. If you really think about it, these stats are pretty staggering. So the question is what is health? Is health to you just feeling good? Most people say, well, I'm healthy if I feel good. If I have no symptoms, I must be healthy. That's not a good way to look at it, because if you look at heart disease, this is a study on heart disease, 80% of the deaths resulting from heart disease in people under age 65 occurs during the first attack, meaning the first thing that let them know that they had heart disease was the heart attack that killed them. Now the question was, did they just develop heart attack that day? No. They developed heart disease a long time before. They've been developing it for 10, 20, 30 years. In fact, nowadays they can find heart disease developing in kids at like 6, 7, 8 years of age because of obesity and all of that. So health is not just feeling good. You can feel great and die the next day. So that's not a good way to judge your health. Our definition of health, or the chiropractic philosophy, is health is having 100% function of all of your organs 100% of the time. So you don't want to gauge your health based on how you feel. It's not a very good way. So why are we so symptom-oriented? Why is the public, why are we that way? Well, we've been sort of brainwashed into believing that symptoms are the only way we should take care of our health. I mean, we've got the TV commercials every single time you sit down at home. Excedrin, the headache medicine. I mean, we've got Nuprin, Tylenol, all these different drugs that are constantly for a specific symptom. And we get very symptom-oriented instead of health-oriented. This doesn't work very good. Now, my question that I have for you is, if you are taking medications, and I'm not telling you need to go off your medications right now, because we don't do that in this office. What we do is we tell you that as you get better with your health, you can go back to your medical doctor and you can start to come off of some of these medications. You can start to reduce these medications, and it happens in probably 85–90% of the patients we treat. They can come off of some of their medications in time, but we don't personally take you off these medications. But let's look at like pain medication. What does pain medication do? Does it actually go in and fix the problem? What does it do? It really masks the symptom. It's kind of like you driving down the road and the oil light comes on in your car. That's a symptom. That's telling you, hey, you're not healthy right now. Okay, something's wrong. I mean, it's telling the car, basically the car is saying, we have a problem here, we're out of oil, or we got the check engine light comes on. Now imagine if you just pulled into the gas station and the guy that was working at the gas station came out and said, I got the perfect thing for you, and he put some black electrical tape right over top of the light and says, continue driving. Well, that's kind of what's going to happen to your car. Your car is going to eventually, it's going to break down, but it's not going to break down right away. And that's the trouble with medicine, is medicine only masks the symptoms. It never gets at the root cause of the problem. And so we're doctors of cause. We're very concerned about the cause of your problems. So proactive versus reactive healthcare. Proactive is doing things before you have a problem. Reactive is waiting till you're in really bad shape. Now the sad thing is most people that come and see us are being very reactive. In fact, most people that come and see us have been to multiple doctors. The medical system has failed them, and that's the reason why they've come here. What you're going to find out is that maybe they should have been coming here before, and instead of waiting until they already have a problem. But 5 factors of optimal health. Number 1 is proper nutrition. You've got to eat well. That's our metabolic care. We could do a whole workshop on that just specifically. You are what you eat. Number 2 is proper exercise. Now we're going to give you exercises right now in this office that are going to be specific for your brain. They're going to be brain-based exercises. They're going to be spinal corrective exercises. But once you get your spine healthy, you need to be under cardiovascular exercise. You need to be getting at least 3 to 4 20 to 30 minute cardiovascular walking exercise sessions, treadmill, something like that, elliptical. Absolutely essential. Prevents heart disease. Number 3, proper rest. Got to take, that's when your body repairs, so you got to make sure that you get plenty of rest at night. Number 4 is a positive mental attitude. People that have very negative thoughts, they don't have good spiritual health. I mean, your brain controls your body, and if you've got this constant negative thoughts, then you're going to have negative or poor health. And then the last thing, and we're going to talk about this heavily today, is the optimal functioning nervous system. An optimum functioning brain, spinal cord, and spine. That is absolutely essential to health, and you're going to understand that fully today after you're done watching this. So what is chiropractic philosophy? Well, number 1, your body is a self-healing organism. Your body has the power to heal itself. In fact, it's doing it every single day. Every single day your body is healing itself. It breaks down and it repairs. Number 2, the nervous system controls all functions. It controls all processes. The brain and the spinal cord, messages from the brain go down the spinal cord and they go out and control every organ in your body. The structure of your spine, healthy structure of your spine, is very important to your central nervous system. Proper structure equals proper function. So proper spinal bone placement and posture controls function in your body. Posture is absolutely essential. Number 4, changes in the structure of the spine. The spinal column will affect your health, and we're going to talk about why that is. So here's your nervous system, okay? Your brain obviously sits up here. The brain sends the messages down the spinal cord, and the messages go down the spinal cord and they go out to nerves, and the nerves control every organ in your body. It controls every muscle in your body. The ligaments then fire back up into the brain, and so this is like your spinal cord is the connection from your brain to your body, and from your body back to your brain. And so there is a normal position for your spine to be in, okay? And the normal position of the spinal bones is essential for the health of the spinal cord. Now what happens is the function of your spinal bones, it has multiple functions. One of the functions is movement, okay? So people that have healthy spines have good, healthy movement. They've got full range of motion without pain. You should be able to bend down, twist fully to the right, twist fully to the left, bend your head this way, bend your head that way. You should have absolutely no pain. The other thing it does is it provides support and posture. It holds your body up, okay? And then the third thing it does, the bones of the vertebral column protect the spinal cord. It's the only part of your body completely encased in bone is your spinal cord and your brain. Okay? Now your brain is encased in the cranium, and so that's one solid piece, but the bones of the spinal column are movable, so they can lose their normal position. So just like there is a normal blood pressure, and there's a normal, you go see your medical doctor, or you see us, and we're looking at your lab values, and we're looking at your cholesterol and your thyroid, and there's these normal reference ranges. Well, there's a normal for the spine to be in, a normal position for the spine to be in. And the normal position for the spine to be in is as follows. The spine needs to be perfectly straight from the front. If you look here, perfectly straight. Straight spine is a healthy spine. And from the side, we should have 3 curves, one in the neck, one in the mid-back, and one in the lower back. When we have that position in our spine, the spine is incredibly strong, and it resists degeneration, it resists arthritis, and things like that. But what can happen, because these spinal bones move, there are things that can happen. There are forces that can happen through a lifetime that can cause us to lose the normal structure in our spine. We can lose the curve in our neck. We can lose the position in our spine. This loss of position is called a subluxation. A subluxation means a misalignment in the spine that puts pressure on the nerves and affects the communication system from the brain out to the body. Okay, so you can have a subluxation in this nerve here. This nerve may go out to the heart, and it may affect heart function. Okay, it puts pressure on the discs. It puts pressure on the joints. So a normal spine, very important, is straight from the front, 3 curves from the side. That's one of our goals for care, is to more normalize your spinal position. Okay. So an example of that is this curve here in your neck. You should have a nice, good curve in the neck. This black line is normal. Okay, you can see this red line. This person has lost that normal curve in their neck, and then this is the normal position. So abnormal, normal. This causes poor health. This is going to cause good health. Okay? So the next thing we want to talk about is we're going to go over a couple spinal x-rays and some spinal corrections. I'm actually going to zoom the camera in so we can go over some of these x-rays so you can really understand what I'm talking about proper spinal structure versus abnormal structure. Okay, now right now we are going to go over some x-rays just so you can get an understanding of what a normal spine looks like versus an abnormal spine. And we got you zoomed in here, so you're not really going to see me, you're just going to see my hands and me pointing out normal. So here's the deal. Basically, when you look at spinal x-rays, first thing we're going to do is we're going to look at the side view. We're going to look at the side view of the neck, where you should have a nice normal curve. So this is the normal spine, and when you look at the normal spine, it should have a nice curve in the neck. So we're looking at the neck, side view of the neck, and there should be a nice open disc spaces. Now, disc spaces are, the discs are the cushions that are between the bones, and they provide space between the bones so the nerve can exit out. And that nerve can go to muscle, it can go to your organs, it can go to, you name it, it can go to any part of your body. And so when you have good open disc spaces, you're going to have nice open areas for these nerves, or spaces for these nerves to go out. Okay, so that's normal. But what can happen is we can start to lose the structure, and we're going to go over the causes of what causes this to happen. And so that's what we call phase one. Phase one, we now lose the curve in the neck, and so the black line is where the patient should be, the red line is where this patient was. This was a patient with migraine headaches, a young girl. But what now that does is when you've got this curve in your neck, what that creates is it creates more pressure or loading in the back of the spine instead of the front of the spine. Now the joints in the back are supposed to take up the weight of your head, where the joints in the front are for movement. And so what happens is when you lose that curve in your neck, it'll start putting more loading on the front. And when you have more loading on the front, over many years, if you don't have that corrected, you go into phase two. Now in phase two, what happens is the disc spaces start to get really, really thin. So instead of having nice, big, healthy disc spaces like so, like you have in the normal one, nice open spaces, which are these little black areas in here, right? What happens is the longer you're in phase one, eventually you go into phase two, and in phase two you start developing discs that are severely decayed and degenerated. And so instead of having nice space between the bones, you got these discs that are falling apart in here. And what that does is it narrows the space where the nerve exits out, and what that creates is it creates a host of problems, and can cause chronic pain, it can cause pressure on that nerve, you can have all kinds of issues. And then we go into phase three, and in phase three, what happens here is you'll see you should have a good curve here. This is the red line, and so you can see in through here that the discs are in really bad shape. Phase three means that it's almost bone on bone, and that's called arthritis or degeneration. It's really the same word or the same term, but this guy came in and he had chronic neck pain, he had pain down into his arms, numbness in his arms, because the nerves that came off of here go down into the arm. Okay, so let's look at normal versus phase one here. So this is normal, that's the way the spine should be, and again the discs are nice and open in through here. That's healthy, and that person's spine is going to stay healthy through a lifetime if they maintain it. Now this is phase one, and you can see the poor structure, loss of curve in the neck, and this patient was a 15-year-old girl with chronic migraine headaches. All right, and so you can see that she lost that curve. Now, why does she have migraines? Does she have migraines because she is not taking enough medication? No, she has migraines because of the fact that she's got pressure on the discs and the joints and the nerves. And most people's headaches and migraines have a big, there's a big component to the cervical spine that it's causing them. So that's the way the spine should be, and she was like that. Turned out she was in a car accident, and that's what caused that. This is a phase two, that's normal. Phase two, you can see now the discs are getting real thin in here. This was a patient who had chronic neck pain. She had pain down into her arms and pain into her shoulders because the discs were getting degenerative. They were getting small, and so they were putting a tremendous amount of pressure. This is the phase three, and the phase three, I mean, this is almost permanent. This is permanent at this point. We can't fix phase three. And we can make a person feel better in phase three, but when they're in phase three, this is severe degenerative changes. This is years of poor spinal structure. And a lot of people will say, well, oh, isn't that just old age? Well, this guy was about 75 when he came into the office, and everybody says, well, it should be just old age, right? Well, if he's 75, then these bones that are degenerated are 75, right? The ones that are like that, and the ones that up top, where actually the curve is going in the right direction, they're nice and open up there, right? And those bones are 75. So the question is, these bones are 75, these bones are 75. How come these aren't degenerated and these are? The reason why these are degenerated is because of the loss of structure in the curve in the neck, and that made these bones degenerate faster. Okay, so proper structure equals proper function. This is a study. Loss of the cervical curve stretches the spinal cord 5 to 7 centimeters and causes disease. And that's Alfred Bragg. He's a neurosurgeon who is also a Nobel Prize recipient, did a lot of research on the brain. He says it actually stretches the spinal cord. So if we look back here, the curve, when we have a nice normal curve, there should be a nice, the spinal cord. So this is a cross section. These are studies of cadaver studies. When you have a good curve, there's ample space for the spinal cord to come through. When you have loss of structure and poor alignment, the discs degenerate and they bulge in and put pressure on the spinal cord, which will shut down the messages coming from the brain to the body. You got to remember, the spinal cord transmits messages from the brain to the body and back from the body back to the brain. So this person has decreased electrical current, a decreased function coming down through the spinal cord, and they have pressure because of that disc bulge. And the longer it goes, the more degenerative changes occur, and you can see even more and more pressure. These are actual cadaver studies. This is a phase 3, and you can see how much pressure is on that spinal cord. This person has a very poor quality of life when they're like that. So let's continue along. Again, here's more studies. When you have that loss of curve, again, here's another example of an MRI. This is a bulging disc. These discs bulge back into the neural canal and can shut off life and information flowing through, and you may have anything from poor function of your organs, your heart, your lungs. You may have numbness and tingling in your extremities. These are all possibilities. All right, so there's an example of a disc bulge putting pressure into the spinal cord. Okay, that's what occurs when you lose the curve. Now we also have what's called forward head posture. Forward head posture is another type of subluxation. It's along with the loss of curve, and when it gets really bad, this is normal. You should have that nice good curve in your neck. This is somebody with forward head posture like this, and this is somebody with severe forward head posture. I mean, they're really hunched over, completely hunched over. And I'll give you an example. I have a poster to show you. This is posture decay. Okay, you can see normal would be like this guy here. This is somebody moving into poor posture, and then this is somebody that has completely lost the normal position of their spine, and that's what it looks like on X-ray. These types of patients have severely, they have poor energy. They have, they just don't function well because their head goes so far forward. So this is an example of forward head posture. It's been studied that forward head posture can cause headaches, neck pain, TMJ, arm pain, degenerative arthritis, thoracic outlet syndrome, which causes numbness and tingling in the arms, stretched spinal cord and nerves, which we talked about, deformed ligaments, muscle spasm, stretched blood vessels, and it causes the discs to decay. This happens more rapidly in a patient that has this going on. Progressive forward head posture syndrome. For every inch of forward head posture, it can increase the weight of the head on the spine by an additional 10 pounds. And that's Physiology of the Joints, Volume 13. Forward head posture leads to long-term muscle strain, disc herniations, arthritis, and pinched nerves. That came from the Mayo Clinic. They came and they've done studies on forward head posture. So we got to correct that. So here's an example of a correction. The person had this forward head posture. This is where they needed to be. This guy worked on a computer all the time, and so he had this forward head posture that developed over years of working on a computer. This is our post-X-ray, and so now when he stands in front of the X-ray, he stands perfect like this without any muscular effort, and that's a correction. Now, here's another one. This guy had severe disc damage in his neck. We did spinal decompression therapy and corrective care, and that's a pre and a post-X-ray, and that's the changes that we made with that patient. This guy got out of his neck pain. He got out of his disc pain, which was causing pain down into his shoulders and arms. If this doesn't get corrected, this was the first correction I showed you with forward head posture. If that doesn't get corrected and the person goes many, many more years, this person is going to move from that to that. So the person is going to go from looking like that to eventually looking like that over many years, because subluxations are cumulative. This is a spinal curve correction. This is the girl with headaches, chronic migraines. This is our post x-ray. Her migraines were gone after that. This is a patient, I already showed you this curve in the neck. She had chronic disc problems. We restored that arc back in her neck, took the pressure off the spinal cord, and she's doing a lot better. Her neck pain went away. This is another, from the front, the spine should be straight. This guy was in a wheelchair. The spine should be straight, okay? And his spine went off to the right. Now, he didn't have paralysis, but he had so much pain that he barely could walk, this guy, when he came into the office. So he actually arrived, and we got him to a walker and actually to a point of not needing any of that. He had chronic pain down into his legs, stiffness in his legs. He had what's called spinal stenosis. And this is our pre- and post-x-ray. We improved his structure that much, and he improved dramatically. Proper structure equals proper function. This is a little boy with asthma. He had big misalignment up here in the upper neck area, which was putting pressure on the spinal cord and the nerves up there. We restored that structure in through here, and his asthma went down dramatically. He got to the point where he didn't need to use his inhaler anymore. Now the lumbar spine, we've got the same thing, phase 1, 2, and 3, and normal. And this is pictures of the lumbar spine. We're looking at the spine from the back straight on like that. The spine needs to be straight. When the spine's misaligned, it's going to do the same things to the discs. Here's an example. We call this a right thoracic shift. It means that person's spine shifted to the right. This is why we look at your posture in the exam, because we can see, do you have any shifting? What that does is it creates more loading. Posture affects and modulates every physiological function from breathing to hormone production. Spinal pain, headaches, mood, blood pressure, pulse, and lung capacity are among the functions most easily influenced by posture. That's the American Journal of Physical Medicine. They did that study. When you're shifted to one side, it puts more loading on one side than the other side, and it's eventually going to cause the discs to bulge and degenerate. Okay? Here's an example of a correction. This person had a shift to the left, basically a scoliosis in the spine. And she had chronic pain, she had sciatic pain because the nerves from the lower back go down into the legs. And this is our post-x-ray after a course of care. This is an example of surgery. When the discs finally get like this and they're so bad, the medical approach is to fuse the discs up. Now, what do you think's better? Being reactive, letting that happen, or do you think being proactive and fixing the structure in the spine? Correcting the poor alignment in the spine, straightening it up so the discs never wear out? I mean, I think the answer is obvious. The lower back from the side should also have a curve like the lower back from the neck. You should have a curve like that. When you lose that curve, the discs will degenerate and get thin. And this is a MRI, and you can see the disc bulging in here. This is the spinal cord. It ends up here, and then these are the nerves that come down through here. And so this bulging disc will put pressure and bulge into the spinal cord. Patients that have that going on can end up with sciatic pain because the nerves in the lower back put pressure. They go down into the legs. So patients with disc problems in their lower back can have sciatica. They can have numbness and tingling in their feet, weakness in their legs. For those types of patients, we use non-surgical spinal decompression therapy before we get into the corrective process. So the goal there is to open up the disc spaces and suck that bulging disc back off of these nerves and make these discs get healthier again. And then once we get them to a point where they're pain-free, then we want to correct the structure in their spine. Okay? Now, how does all this happen? Well, physical stress, emotional stress, and metabolic stress, and we're going to talk about that right now. We're going to actually zoom back in so you can see me and we can talk a little bit more about the corrective procedures we use. Got through talking about the x-ray, so I think you have a good understanding of what normal looks like, what a degenerative spine looks like, what a spine looks like when it's subluxated or misaligned. But then the big question always comes up, well, Dr. Childs, what causes this to happen? I mean, why do patients go from a normal, healthy spine to poor structure? Well, there's really three things. There is physical stress, emotional stress, and metabolic stress. And we're going to talk about the physical stresses here in just a bit, but let's talk a little bit about emotional stress. People with emotional stress have a lot of cortisol that is released from their adrenal glands. Cortisol is toxic to your brain. And what really holds your spine in its normal position is good brain function. When your brain is functioning at 100%, you're going to have good extension tone. When you have healthy cerebellum function, you're going to have extension. You're going to actually stand nice and straight. So people that are under a constant stress have a lot of cortisol. Now, cortisol is toxic to your brain, so it decreases the frequency and firing of the brain, and so it starts to make you move forward like this. Now, here's the other thing about the emotional stress is people that have emotional stress just naturally tend to, depressed people tend to be more like this. They don't stand as straight. So emotional stress is a big part. Metabolic stress, patients that have diabetes, patients that have high blood sugar, patients that have thyroid conditions. These are all very bad for brain function. Bad brain, bad posture, bad spine. Okay, so that's how the metabolic and the neurological care affects the spine. Now the other thing is physical stresses. So let's talk about what these are. Here's some common repetitive stresses, and we're going to talk about these. Sitting in a car. When patients sit in a car, their head's kind of forward, and that can cause forward head posture. Sports and riding bikes and sports injuries and lifting injuries and people that work on a computer all day. When you work on a computer all day, that's one of the biggest reasons for forward head posture. People that sit for hours. I mean, if you're sitting in front of a computer and you have poor ergonomics, I mean, that's going to, over time, your internal architecture of your body is going to conform to the intensity of those things. That's why patients have chronic neck and back pain and migraines when they work on computers all the time. Poor sleeping positions, people that lay on their back and they've got too many pillows behind their back, or they fall asleep on the couch. I mean, there's any number of physical things. Gravity, over the years, will push you forward. I mean, we live under gravity, and over time, gravity pushes us forward like this. So there's any number of physical, or what we call universal forces, these things that are constantly affecting us in life. So again, how did your spine get like this? Well, a couple things. Traumas, birth traumas, car accidents, falls, sports injuries, chronic poor posture, and the birth process. The birth process is one of the most traumatic things that you ever go through. In fact, it's been studied, there's medical literature, that the birth process can cause misalignments, especially the birth process when they use forceps deliveries or they use vacuum extraction. And so the medical studies show that trauma to the upper cervical spine can occur during delivery and can cause two problems. It can lower the immune resistance. This is why we see a lot of kids in our office. Some of the kids are in because they have ADD or ADHD or neurodevelopmental disorders, but they're also in because a lot of them will have frequent colds or ear infections and things like that, because when you have poor structure in the upper neck, it's going to lower your immune resistance. Number two, it's going to cause the spine to grow abnormally, and scoliosis, abnormal development of the spinal curvatures. People that have birth injuries or birth stresses that may never even be diagnosed, it can cause the spine to grow in poor structure. So you can have subluxations right from the day you're born. As the twig is bent, so grows the tree. Very important for you to understand. So proper development is essential. In fact, there's been research from Harvard Medical School by a guy named Abraham Tobin about traumatic birth syndromes. Research indicates that the major cause of spinal subluxations in infants is childbirth, stressing the need for correction from birth so that irreversible degeneration does not occur. Nerve system injury through cervical spine trauma at birth causes abnormal function, abnormal behavior, and early death. Sudden infant death syndrome. One of the theories, or one of the studied theories on sudden infant death syndrome is it's due to birth trauma. Too much trauma. We use a lot of drugs that really shut down uterine contractions. They have to pull on that baby's neck to get them out. And that's why your kids should be checked from birth. This is why you'll see us adjusting sometimes infants in the office. Now, we don't have to crack and pop their neck. We can just use a little bit of light force with an instrument. Very gentle and very effective in helping kids with all types of health injuries. I mean, health issues like colic and like poor digestion, and kids that have ear infections and allergies and things like that, asthma like we discussed before. A couple other traumas, any car accident that you've had, any whiplash injuries. Whiplash is a big force. So any car accident you've had, even if it was just at 5 miles an hour, can cause you to have a whiplash injury. So you can actually, you can be standing right here and all of a sudden, bam, that's what happens to your neck. And so we can always tell when somebody's had a whiplash injury because they must always have a kyphotic or reverse curve, which stretches the spinal cord, causes migraines, things like that. So how do we fix your abnormal posture? Well, what do we do? So let's say this girl, she has a right head translation. So her spine should be straight. You can see it shifts to the right. Well, we're going to use a couple things. We're going to use exercises, specific exercises. So if your head's like shifted to the right, we're going to start shifting it back to the left repetitively to straighten your spine. Okay? That's going to work the muscles. There's three things that hold the spine in an abnormal position. There's muscles, there's ligaments, and there's nerves, or there's brain function. Okay? So the second thing that we do is we're going to do adjustments. So an adjustment is a mirror image adjustment when we're talking about a biomechanical adjustment. So let's say your spine is shifted this way. We're going to lay you on the table and we're going to shift your spine that way, and we're going to adjust it to start to change the way the cerebellum holds your posture. Your cerebellum controls all of the unconscious muscle posture. So the way you stand is not really voluntary. The way you stand is your cerebellum's tone and its function. So if you're shifted this way, we're going to bring you here and we're going to start to adjust you to start to retrain the nerves. Okay? The other thing that we're going to do is we're going to do traction. Traction is a type of force that's going to hold the spine in a position for a period of time that's going to change the ligaments. Ligaments are like elastic. And so if I just real quickly do that, they're like rubber bands, they're going to go right back again. But if we hold them over time, what that's going to do, like in this tractional position or in a sustained position, it's going to make those ligaments deform and change. So let's say you were shifted that way, we're going to do traction back that way. And when we do this repetitively over time, what will happen is the spine is going to change. Here's some more examples. Forward head posture. This is the exercise for forward head posture. This is the adjustment for forward head posture. And this is the traction for forward head posture. Okay, so we have an exercise, an adjustment, and a traction for every type of possible position that your spine has gotten stuck in over the years. The other thing we do is brain-based care, fuel and activation. We've got to get your nutrition well, because when your brain changes, your brain needs fuel and it needs activation. We may put you on oxygen therapy. Activation is going to be specific brain stimulations and to create balance. So let's say you've got a bad left cerebellum. We're going to do all your adjustments on the left side to facilitate more function in the left cerebellum. That's going to create balance and it's going to help improve the structure in the spine. So we also do brain-based care, neurological care for spinal correction. Let's talk about a couple philosophy principles and then we'll be through with this video. A couple of these were developed by B.J. Palmer, and B.J. Palmer developed these principles to help people understand the philosophy of what chiropractic is about. So we're going to read through these and then this will help you understand a little bit more. So through the power of the innate intelligence, your body's innate intelligence, the human body has the ability to reorganize itself towards optimum function on a moment-to-moment basis. So through the power of innate intelligence, your body has an innate wisdom, and that innate intelligence is in the nervous system. The nervous system controls and dictates the repair and function in your body. So through that power, through the power that's within the nervous system, your body has the ability to reorganize itself. Health is organization. Number two, the power that originally organizes the human body is the same source for reorganization of the human experience throughout life. So when you're a child, what will happen is, or before you're even conceived, you have a sperm and an egg come together. That sperm and the egg comes together, and it comes together and forms one cell, and that cell splits and splits and splits and splits and splits, and eventually it becomes a little ball of cells. Well, that ball of cells becomes the brain. And eventually that cell elongates and it becomes the spinal cord. So the first thing that develops is the brain and the spinal cord, and then everything else develops off of that. So the power that originally organizes the brain and spinal cord is the same source that organizes the body throughout life. So your brain and nervous system is constantly reorganizing you. The human body is in a constant state of breakdown and repair. The breakdown is a result of universal forces. Universal forces are the stresses, the physical, the chemical, and the emotional stresses that we have. Gravity is a universal force. And so breakdown is a result of these forces, whereas the repair is a result of the innate sources. The brain and central nervous system constantly creates survivability and repair in the body. The repair cycle must meet the demand for the breakdown cycle to sustain optimum healing and maximum expression of life. The repair cycle has to exceed the breakdown cycle. Okay, and so we're constantly breaking down. Your liver is new every 6 weeks. As a result of proper healing. You have a new heart every 3 months, you've got new red blood cells every 90 days, a stomach lining every 5 minutes, you've got new skin every 30 days. So all the cells break down, and all those cells are constantly being repaired. That doesn't happen in a dead person because they're neurologically dead, and so the nervous system controls all that repair. Does that make sense to you? You're constantly breaking down and repairing. Now, if your breakdown exceeds repair, you're getting unhealthy. These are the people that come walking into our office of years of breakdown exceeding repair. Their spine's breaking down, their blood panels are horrible, their brain is starting to become inflamed, and they're becoming unhealthy. Breakdown exceeding repair, greater than repair, getting unhealthy. If repair exceeds your breakdown, then you're healing. You're improving function. If your repair equals breakdown, then you're staying the same. Does that make sense to you? Our goal when you come in, corrective care is the repair exceeding breakdown. Wellness care is keeping repair at least up to breakdown. Okay, so how do you want to age? I mean, this is a normal spine. Breakdown, and if this person maintains this spine, breakdown is going to exceed, repair is going to equal breakdown. This is an example of somebody's spine where breakdown has exceeded repair for years. Many, 20, 30, 40, 50 years. These spine, I mean, the discs are severely degenerative. This is completely preventable. Completely preventable if you maintain healthy spinal structure. Okay? If you're proactive with your health. So how do you want to age? Do you want to age like this? People that age like this have poor quality of life. These aren't the kids that are, the grandkids are running up and jumping into their lap. And these aren't the 85 and 75, 80-year-old people that go out and play tennis and go walk in the mall and shop and do all this. No, they don't do that. But if they maintain their spine, they could. Another philosophy principle. The subluxation is a breakdown phenomenon brought about by these universal forces. Your body absorbs them. Over years, it absorbs gravity, stress, work, sitting in front of a computer all day, in a car for an hour a day, to and fro. These universal forces accumulate, which in and of itself is going to obstruct the transmission of the innate or the healing forces that come down. It sounds weird. It kind of sounds like Star Wars or something like that. But it obstructs the transmission. So if your spine's out of alignment, it's going to put pressure on that spinal cord, and it's going to obstruct the transmission of that life force, or the functional force, or the electrical impulses coming down from the brain. They're going to be obstructed. This obstruction is going to lead to breakdown exceeding repair even further. It's going to result in sickness, poor function, and disease process. Okay? Not the only cause of disease process, because we have diet, we have lack of exercise, but poor spine will cause that. Number 5, the chiropractic adjustment, the chiropractic traction, the chiropractic exercise provides specific forces for the way your spine is misaligned, intentional forces designed to correct and repair the subluxation, remove interference, repair the interference between the brain and the body and the brain, and allow the body to resume proper repair to breakdown healing ratios. So that what it means is we increase repair and we decrease breakdown, which is going to cause healing. That's what we do. Number 6, all healing and repair takes time. That's why we can't fix you in 2 visits. It took you many years. If your spine is severely degenerative and out of position in phase 3, it took you 50, 60 years to develop it. It's going to take us time. It's going to take us repetition and intensity, because it's important. The spine to change is going to require repetitive adjustments. That's why you come 3 times a week. It's going to take time. That's why you need to come anywhere from 3 months to a year. And it's going to take intensity, you making the changes and doing the exercises. Because here's the thing, universal forces are always there. Gravity's always there, stress will always be there, poor eating will always be there, smoking is always going to be there, pollution's always going to be there, car accidents are always going to happen to people. So these forces are constantly there, which is going to affect repair cycles. That's what makes lifetime adjustments cycles vital for total and complete expression. Now here's the thing, when I say lifetime, I mean lifetime. The reason why I mean lifetime is because once you start exercising well or start eating well, how long do you need to do that to maintain the benefits of that? You need to do it for a lifetime. See, all proactive healthcare, exercise, nutrition, chiropractic, all this stuff should eventually be lifetime. So we're going to explain that. But you don't have to come lifetime. You may just come just for corrective care, and then you leave. We'll explain it. So here's the care phases. Phase 1 is 3 months, 3 to 4 times per week. The goal in that phase is to improve your health, to improve your function, to correct your spine, to get you out of pain, right? That's that first phase. Now some people in phase 1, their spine's so bad and they've got so much metabolic issues and so many issues there, we may not even get to correction at that point. But at the end of phase 1, we retake an x-ray. Phase 2 is 3 months, usually twice a week at this point, okay? And the goal there is to either continue correction or to start correction. And phase 3 is 6 months, 1 time per week. And the goal there is to really drive home the correction and make that correction yours, so it doesn't go back the old way. So that's phase 1, phase 2, and 3 of what we call corrective and therapeutic care. And then the goal is to go on to some type of wellness care. The goal of wellness care is to keep your spine healthy for the long haul. We see 1 to 4 adjustments per month. Now I want you to understand, wellness care doesn't require you doing decompression and all the oxygen and all the different things that we do in the office. It's just adjustments, home exercises, so it's very affordable in your lifestyle. So, and we recommend getting adjusted for a lifetime, because once your spine is out of alignment, right, we want to get it into alignment, and we want to keep it that way, so when you're 80, you're not all in bad shape. You've put it's kind of like a bank account. You've put health dividends into your bank account, so now you have good, healthy structure. And 1 to 4 times a month, it depends upon how bad somebody's spine is. If their spine is in phase 2, phase 3 severe degeneration, they may need 3 or 4 adjustments a month just to stay in good shape, where the person that took care of their spine early may only need 1 per month. Okay, so that's wellness care. The big idea, here's the big idea. The big idea is wellness for you and your family and friends. Now what do I mean by that? How many people do you think know about this? I mean, you may have a friend at home that has chronic headaches and all. They think that the Imitrex and the medications is all they have as a means of getting well. There is so much people can do outside of drugs and surgery to get well. And so the ultimate goal is to take people that are chronically sick and get them healthy, and then get them onto some kind of wellness so they have the highest quality of life through a lifetime. Okay? But even better than that, the ultimate goal is to never let people get sick at all chronically. Okay? So you may have come in with chronic back pains and neck pain and vertigo or whatever your problem is, fibromyalgia. Well, what do you think is going to happen to your kids, your husband or wife, right? Your loved ones, if they don't start taking care of their spine? It's eventually going to catch up to them. So the ultimate goal is to have people come in before they're sick and before they have all these problems to maintain their spine. Now, if they're only involved in maintenance care, then they're not going to need all of the extensive metabolic care, oxygen therapy, neurological, brain-based care, biomechanical care. They only need to come in, get adjusted, do some home exercises. They may be in here 5-10 minutes, that type of thing. So that's the ultimate goal. That is what we call the big idea. Wellness for you, and wellness for your family and your friends. So that's basically it. Thanks for watching this DVD. If you have any questions as you go through care, don't hesitate to ask. If you have any questions and you'd like to set up a private time with one of us, Dr. Durai, you can just ask the girls and we can do a private consultation time. But thank you for watching this video. We'll see you for your next visit. Take care.